So Denise Richards has recently revealed her facelift results, and I think she's genuinely beautiful. But social media has been quite brutal, calling her a joker face, mask face, looking too fake. And as a plastic surgeon, I feel like I need to weigh in. Because some of these comments are just mean and cruel, but some of them are pointing at something real. So when a face is overdone, that mask-like, tight, slightly off look, it's almost never about just one thing. Take the lip corners as an example. That fixed, upturned mouth that people call joker face, it could be from a corner lip lift, or it could just as easily be years of filler use, because fillers can stretch out the tissue. It doesn't really dissolve all the way. So over time, it quietly distorts the shape of your mouth. And sometimes it's very hard to tell from a photo. And the cheek hollowing is a separate conversation. When too much volume is removed from your face, whether it's from a buccal fat removal or from aggressive surgical technique where you tighten the facelift a little bit too much, then you lose that softness that you see in a younger person. And the face ends up looking more severe instead of looking lifted.
And that brings me to a trend that I've been watching in my field. There's a real appetite for very sculpted, very defined results, sharp jaw lines, prominent bone structures. And I understand that it looks very striking in before and after photos, and it photographs very well. But in real life, it looks gaunt, and it really doesn't look that great on women. Because youth isn't about sharpness. Youth should be soft. Look at any women in their 20s, their fullness, that padding, that soft curve. When we surgically remove that to chase after an angular look, you end up creating something that looks gaunt rather than youthful. The best facelift should look like you like maybe 10, 15 years ago. It really shouldn't look like a caricature or like a mask of you. Denise Richards is a beautiful woman, and I hope she loves her results. But the conversation in those comment sections, brutal as it is pointing at something worth talking about.
I think patients deserve to know what drives these outcomes, and to always remember that the photos you see online are curated, filtered, and has professional lighting. So what looks flawless on Instagram isn't always what walks into a room.